Hi, Scott. How are you?
Great, very good, thank you.
All right. It is officially 3 o'clock, so I think we'll go ahead and get started. Thank you to everyone who's joining us today. I want to give a special thank you to our building principals our middle school building principals who are joining us. And I believe the others are joining in a few minutes. So appreciate you taking your time. It looks like our participant level is not very high right now. So I think I'm going to give it maybe 2 minutes before we get started. Scott, how's everything at Schofield?
Going pretty well. Setting up cafeteria desks right now.
Great.
I'm not, but it's happening right now.
It's happening now.
Yes.
Yeah.
That's why I was just on my radio a moment ago.
How many will fit in there?
Our cafeteria, the alternate locations, the lobby and the atrium, we can fit about 50 desks in each location.
Okay.
Each area has a bunch of half a dozen or more benches that are there, have been there. So
Yeah.
we're using those as additional seating. So
Right.
in total, we're between 55 and 50 and 60 some odd, plus or minus, in those two locations for lunch.
Kind of nice to be eating in kind of different locations. That's a nice entryway.
Yeah, upstairs, they're looking out into the parking lot. It's nice.
Going to be, and on these sunny days, it's like eating at the mall or something in the food court.
I may go join them.
Right. Hi, Matt. Hi, Brendan.
Hi, Tamu.
Matt, did your son see you on the news?
He did, and he couldn't care less.
Like, oh, Matt's the star. How exciting.
He was like, can we watch Spider-Man now, please?
Oh, that's great. It was a good story.
Yeah, it was nice.
All right, I think we're going to go ahead and get started. I'll start over again in thanking our principals, not only for joining me today, but for your leadership in getting us ready to reopen 5 days a week. Really appreciate all that you've done. And I know that you have been working really hard with your custodial staff who has been working hard over the weekend to start to at least, if not set up, but really think about what it's going to look like, especially at lunchtime. So as part of the listening session, I did just want to take a few minutes to go over a few things so that we had some sort of conversation about questions that have been asked over the last week and a half, and things that people just might want to generally know about. So as you know, our elementary staff had the option to be vaccinated this weekend. We had about 719 of our staff register. Really a big thank you to our HR department that just went out of their way to make that a smooth process. And thank you so much to Stanford Hospital that was just so gracious in welcoming us. Got a lot of good feedback from teachers. We did have some staff members who did have a reaction. And so we did decide to push off to make today a remote learning day for our staff at the elementary level. We did, they took the Johnson & Johnson 1 dose this week. We're not sure which vaccination that we're getting for next week. That information is sent out by the state on Tuesdays. So the hospital will find out sometime tomorrow, and I will get a call from Dr. Calder, and we will make some decisions on which day it makes sense to do a transition day, and also if we need an additional day. So that information will be out as soon as it's available. I did want to talk just a little bit about health and safety in consideration for reopening. And I had some time last week to talk in a little bit more with Dr. Yoon. I believe everyone knows he's our medical advisor, and just talking through some of we wanted to kind of put on paper some of the things that went into thinking about returning to school 5 days a week and why now. And so one of the things we talked about is the fact that we really have been looking at our data several times a week since the beginning of the school year. And one of the things that became very evident to us that since January, we have seen a steady decline in our positivity rates, our hospitalizations, and our death rates. And because of all of those reasons, it was a time for us to start considering whether or not it might be safe to increase the density of students that would be permitted back into school. We also had a long conversation about the fact that our students did really well with the mitigating strategies that we put in place for them. Who would have ever thought that middle school students without much push would be able to wear masks all day and not really have any issues with that? So knowing that that's one of our strongest mitigating strategies, he did point out to us that that's one of the other reasons why we thought that this would be a good time to go from a hybrid model, which we got very comfortable with in terms of our mitigating strategies, to a 5-day-a-week model, which would have probably been more complicated for us to start day one in that model. We also have learned a lot across the state. DPH has been watching very closely schools that have been in either hybrid or in full in-person model. And what we have found is that whether you're in a full in-person model or you were in a hybrid model, they saw very few in-school transmissions. And so again, learning from our neighboring school districts and even school districts across the state, that made us more comfortable with making this decision at this time. We knew that more community members, people who are over 65, now people who are over 55, have access to the vaccine. We know the more people who have access to the vaccine means that our community rates are going to continue to come down. And because of that, another good reason why this is the time that we might want to consider re-entering school. So really allowing you in our frequently asked questions to see some of the thinking that went into this. And we've been looking at this information for several weeks now. And really after talking to Dr. Calder and Dr. Yoon, felt like this was the time to start to make this transition. I know that our DTLA families are asking, are they able to return to school at this time? And the answer to that question is that we're asking you to hold at this moment. If you, we are going to try to get to about a week back into school before we start making any sort of adjustments. So please stay tuned with your building principal. We'll give you some information about what that would look like, but don't worry, we will be addressing that soon after we are able to transition our hybrid students back into school. One of the most complicated parts, believe it or not, of transitioning students back into school was the lunch period. And those of us, the educators who are on the call, would not be surprised by that because lunch is always a complicated thing. So we have been working with our building principals and our custodial staff to set up an opportunity for students to be 3 feet apart and with barriers up. So you will find in the different areas that your principal has identified for students to eat in, they have either been able to find places that students are able to sit 6 feet apart. If they're 3 feet apart, they will need a barrier up. And I know that everyone's working hard to make that happen. We were able to order some additional desks that actually will be able to be used as nice tables because they will connect back together. But we were able to order some last week. We have some that were dropped at the elementary school this week. We were able to adjust some for middle schools. And now there is another order coming in late next week that would really help fill all of our middle school programs with any sort of furniture that is needed. Let's see, the social distancing and in the classrooms, our gold star is 3 feet. But we also are acknowledging the fact that in a lot of places, it's more like 4 or 5 feet difference. So just know that we want students to be at least 3 feet apart. We also are looking at our bus protocols. We know that for contact tracing reasons, it is helpful for students to be more than 6 feet apart on the buses, but we are encouraging all families, if they can, to drive their child to school. But if not, we know that if students are sitting near someone more than within 6 feet of someone, we are going to have to do more quarantining on our buses. Same thing with our contact tracing, because we have students in classrooms that will be within 6 feet of one another. Again, that 3 feet of apart. When we're contact tracing, it will not look much different than what we've done in the past, but we will have assigned seats at both lunch and in classrooms so that we are able to determine who is within 6 feet of someone in their classes. And those are the students who would need to quarantine. Please know that we are still keeping our 14-day quarantine process in place. However, the health department is looking at it. As you may recall, the CDC and the Department of Public Health for the state did give us an ability to go to a 10-day quarantine period. We have not adjusted in Stanford at this point, but that is something that is being looked at very closely by our health department. And I do want to just acknowledge and really thank Mayor Martin, who has been fighting very hard to make sure that there is COVID testing available. We, in all of our student-based health centers, students or staff that are exhibiting any sort of symptoms when they're in school. You should not come to school sick, but if you are already in school and you start to not feel well, you are able to be tested right there at school. For those of you all who have student-based health centers at your school, if not, there are plenty of testing locations open in Stanford. And so we would be able to get you that information quite quickly so that you can go and get tested if needed. So we just wanted to kind of talk through some of the things that we've been asked questions about. This is available on our website in our frequently asked questions. And as you ask questions today, giving you an opportunity to share any ideas you may have, things we may have not thought of as we continue to prepare for opening next week. We will add these answers, if we can't answer them today, to the frequently asked questions. So at this time, I'm going to turn it over to Dr. Fernandez, who is going to read questions for us. We have our building principals here with us who are happy to also answer questions, but Dr. Fernandez will take us through how this process is going to work so that we can listen to any thoughts you might have at this time. Michael?
Thanks, Dr. Lucero. So just in terms of getting your feedback now and your input, we have a couple different ways to do that. If you have questions, you can simply use the question and answer feature in the webinar. You type your question into that little dialog box and hit return. I'll be looking for those questions and then raising those to the group. If you want to speak, I'd ask you to raise your hand. There's a raise your hand button. You can click that, and then I or Jen will assist with granting you the speaking privileges to be able to speak. We'd ask that you keep those comments to about 2 minutes. We do have about another half hour left for this webinar. And then again, we will be doing this for parents later on this afternoon, this evening, in both English and Spanish, and we will be recording this session for any staff that were not able to participate today. So anyway, if anyone has a question, you could type it into the question and answer box, or if you'd like to speak, please raise your hand and we'll grant you that access. Thank you.
While we're waiting for some questions, does any principal have maybe a question that came up in their school that might be an interesting thing to have answered for our whole group? Oh, here comes a question now, but that'll be a question to our principals if you start to think about, are there any questions out there?
So Dr. Sarah, the first question is, when will we know the vaccine that staff will be getting this coming weekend?
Yes, we should be getting that information from the health. I should be getting that information from the health department sometime tomorrow. I got it around noon last week. And as soon as we know that information, we will get a letter out to staff from our HR department, letting you know which vaccine that has been provided to Stanford Public Schools for this week's vaccination.
Dr. Lucero, I had a question at my school. You touched on this a little bit. So with the elementary school having a remote learning day on Monday and Tuesday, several teachers have reached out and just asked if that will be the case with middle school. And I know you're awaiting what vaccine we're getting, which should come out tomorrow. Do you anticipate whether the announcement of a remote learning day, if there is going to be one, and how many would be out tomorrow?
We do. We did this last week for our elementary team. We sent them a letter that basically said what the transition day was going to look like. We had 1 day plan, but with Johnson & Johnson, because it was only 1 dose, we found that yesterday we made the decision that it would be best for us to push another day. So we will look at all of that information, talk to our health professionals. Dr. Perry at the hospital has been very helpful, Dr. Calder, and we'll make that decision tomorrow and get that information out to staff.
Dr. Lucero, we have another question. Question is, should teachers let someone know if they were vaccinated on their own?
Yes, so good question. The letter that's coming out tomorrow will have 3 choices to it for you to sign up. Oh, you know what? I think this already went out, right? Did secondary already got it? So you should have gotten an email from our HR department that asked you to choose one of 3 things. One, that you would like to sign up, and then they give you choices of times. Number 2, that you have already been vaccinated. Maybe your age group has already came up, or that you have either gone someplace else to be vaccinated, or you are choosing not to be vaccinated with us at this time. I will say that it's really important that you take advantage of this opportunity to be vaccinated, because if you go off on your own and you're not able to get an appointment till, let's say, April, May, there's nothing I can do after this weekend. So I really encourage people to sign up if you have not gotten an appointment at another location.
Anyway, that person just asked if they can resubmit their form because at the time they were not vaccinated.
Absolutely.
They can't.
Yeah, so if you just send that information to the HR department, they will help you get situated.
All right, we have another question. Who is responsible for setting up the barriers, the physical barriers? And if teachers are, will they get the time to do that? And then also who is responsible for cleaning them?
So the building principal is working at each individual building. Most are being set up by the custodial staff, and that's already started. And so if there's anything different at any of the buildings, and principals, feel free to jump in if something's different at your building. And then we're working between Chartwell's and our custodial staff to determine who will clean in the lunchroom and in the classroom, the barriers. Remember, those barriers are not considered high touch areas. Remember, we want to do good hand sanitizing. That's what's most important. So we don't want the kids touching all over the barriers. They really, because they're taped down, should not have much interaction with them. And it's really about good hand sanitizing, which we've been talking about all year.
Dr. Lucero, if I could just jump in on that, and I know every school is going to be a little different, but trying to meet our expectations and stay on track, we have asked everyone to be prepared to divide and conquer. Thus far, our custodial staff has really managed most of that. We have had a few teachers / student volunteers helping out, which has been wonderful. And I want to thank those Dolan staff members and students who have done that. But what I've asked my teachers to do as of last week, just to kind of have a heads up that we may indeed need to have individual classroom teachers help with their set of barriers once they're ready to go on. In large part because we're not exactly sure when each room will be ready with furniture and all set up, although we're on a really good trajectory at this point. We've asked every teacher to be ready to help with their set, but what that's looking like right now is probably helping with affixing them. The folding and peeling and all of that has really been taken care of by our custodial staff and the few volunteers I mentioned.
Thank you. And Ms. Davis actually sent me some pictures today of Dolan and what has happened with the cafeteria. I was able to visit on Saturday, and what you all done between now and between Saturday and now is just amazing. So thanks for all the hard work. And I know that some staff and students helped with that today. So thank you.
There is a clarification of that question, Dr. Lucero. They want to be sure that, so they're expected to have barriers on their desks and that the custodial staff are going to install those.
So the barriers only need to go on desk if you are going to eat in that room, not if you're just 3 feet apart, your mask is fine. Different principals will make a decision on whether or not everyone has access to a barrier. If someone would prefer to have a barrier, we did purchase enough for every staff and student to have a barrier, but the health department has told us that it's 3 feet. If you're eating, taking off your mask, you need a barrier around you. If you are not eating, there does not need to be a barrier there. Is that the clarification, Michael?
Yes.
Okay.
There's a question about providing wipes. I guess at one time we provided wipes and this teacher felt they were effective. And I guess, I'm not sure, but there's an assumption we're no longer providing those wipes.
Yeah, somewhere back in October, there was a question of whether or not children could touch the Lysol wipes or this wipe. So We spoke with our consultant to help with facilities, and we found a spray that was appropriate for students, and we have a spray that's appropriate for adults to be able to use. So if you don't have those access to those in your classrooms, we're happy to, we have that in the warehouse, and we're happy to get that for you. But the wipes got very confusing of, are the kids allowed to use them? Are they not allowed to use them? Now, I know at some buildings, they've decided because they do this for snack anyway, they purchase wet wipes, you know, the ones that just are, it's different than the Lysol wipes. They do purchase that for students to wipe off their desks if they are eating in their classroom, but it's not something that we make available. It's some buildings have purchased them.
There's a couple more questions about the barriers. I'm just going to try to answer it, Dr. Lucero, then if that's okay, and then jump in.
Of course.
Who's responsible for cleaning the barriers between classes? And then because they'll be on students' desks. Dr. Lucero just mentioned that the barriers are not considered high touch areas. Our doorknobs, railings that, you know, the custodians have been doing such a great job at every day cleaning. So the barriers will not be cleaned in between classes. Again, we encourage, and what's most important is good hand hygiene by students and staff, that they are regularly using hand sanitizer or washing their hands. And we know that there's hand sanitizing stations in every single classroom in our school. So I think that's the focus of what we should be doing. We know that there will be a cleaning protocol in place at some point, but the hand hygiene is really, really important. Do the principals have any other questions that they want to maybe bring to the forefront to help develop that common understanding amongst staff? I don't see any other questions at this time, and no hands up.
Dr. Fernandez, there was a question at my building about what we were going to be doing, or if there are going to be any changes to the contact tracing protocol.
Michael, you want to take that one?
Sure. We, Dr. Lucero organized a meeting with the health department actually this morning, and we talked about that. There's been some recent guidance issued by the CDC around contact tracing. Our plan for middle school is to follow the same contact tracing protocol that we have been doing, understanding that we now do have students seated less than 6 feet apart. So we understand, so the contact tracing protocol is that you would quarantine anyone that is within 6 feet of a case, a confirmed case, for more than 15 minutes. So obviously if that student in a particular class, the students that were directly sitting around that student would fall into that close contact scenario, and those students would have to quarantine. At this point though, the health department said it was okay not to have to quarantine the whole class, that we can take that approach. And what's really important though, and was the expectation of the health department, is that we must ensure that students have assigned seats in all of their classrooms so that we can better manage and monitor who's sitting next to who and who's sitting by who to help with the contact tracing. Dr. Lucero, I might have missed a few things there, so if you want to just add to that.
Yeah, so I think it's really important to understand that not much has changed. The whole idea of thinking of your classroom as a seating chart, they talk about, this is the model that they use on airlines with the manifesto of, we know where everyone is seated. And so because of that, one of the first questions that you will be asked is, were all of your students in their assigned seat? And if you're able to answer yes, then we're going to figure out from the assigned seat how far apart your desks are and make a determination of who needs to be quarantined. And that is the health department will be working with building administrators. I do want to say and thank this the city who have identified contact tracers just for Stanford Public Schools. And now there is even after hour contact information that all of our building principals have been provided with. So we will be able to get information about contact tracing up until 8 o'clock in the evening. So we really appreciate the fact that without even impacting us in any way, Mayor Martin has, along with the health department, assigned us specific contact tracers.
We have another question. The question's about vaccinations. If the vaccine that they select is one of the vaccines that requires the 2 doses, this teacher is asking, will we reconsider waiting a few more weeks? I assume before starting the full in-person learning until the 2nd dose has been delivered.
So one of the reasons we've been working so hard to make sure that our staff will have at least 6 feet of space available to them is that we did not use having the vaccination or not have the vaccination as a consideration when we were doing our back to all in-person learning plan. We really want our staff to be safe and healthy. And one of the ways we're doing that is by allowing us to maintain the 6 feet apart, so that we didn't know whether or not and when we were going to get the vaccine. So when we were creating this plan, we created it without the consideration of whether or not everyone would be vaccinated at the time. We are excited that they have prioritized us and that Sanford Public School staff will be vaccinated, but we have created safe environments that staff will be able to be in school and still be able to social distance.
There's a clarification question regarding the previous question about the contact tracing process. The question has to do with, we announced for the elementary level that we would be in quarantining at least initially the whole class. So I think there's just some confusion over that, why that we would be doing that in elementary and this approach in middle school.
Yeah. One of the main reasons is that the elementary kids are together in one classroom the entire day, and there's more opportunities for, mass to get kind of not in a great place, or, different, they're eating lunch in the classrooms together at the elementary level. So with an overabundance of caution, we really wanted to make sure that we have our system down. We will probably transition to the same model with our elementary students at some point, but right now we feel that with our younger students, we need to get in there, make sure that we're able to identify all the students, keep them in their assigned seats, and then assigned seats are easier to do at the middle school level with those students who come into class and then go to their next class.
Dr. Lucero, can I ask a further clarification on that? Earlier in this meeting,
Absolutely.
you mentioned assigned seats for classes and cafeteria. I just want to make sure I heard that correctly.
Correct.
Okay. Thank you.
Thank you.
If the principals or anyone else has any additional questions they want to share with the group, I'm not seeing any.
Well, I don't want to keep anyone longer than we have to. I want to thank you for coming out today and asking your questions. Please make sure that if any questions come up after this meeting, that you are able to have conversations with your building principal. If for some reason your building principal is not sure of the answer to the question, they will make sure that that gets to either my office or to an associate superintendent so that we're able to answer the questions. I think we got one more question that just popped in, Michael.
The question has to do, has the decision been made about district offering virtual instruction for families that need to quarantine due to travel? Last week we were told it would be for school exposure. Sorry.
Yes. So if a student, give me a little more. If a student has to quarantine because they traveled.
Tamu, I can put some context to that if you
Right,
like.
thank you. I appreciate it.
So what has happened is we get families that are going on vacation, quite a few, and they want to switch to distance learning for not only the period of vacation, but the period of quarantine. And that's cumbersome. And my position has been, no, that's not reasonable. And that switching to distance learning is the result of a quarantine through no fault of a child. That's the reason to go to go to live streaming and to be switched to temporarily for distance learning, and not for a family who may have chosen to travel to a location where a quarantine is required. I think that puts some context to the question.
And we'll just remind you that we do have testing sites available. So if you do return within 72 hours and have a negative test, that is a way to opt out of the quarantine. So along with what Mr. Clayton said, you also do have some wiggle room there. If you go and you're tested and have a negative test, you may return to school.
I think maybe that might be something that we can add to our conversations this evening for
Wonderful.
families that go out of town, or some for extended periods of time. I know I've had some folks that have been out of town. They've asked to leave for 2-3 months at a time and to transfer to distance learning. And our position is that that's not appropriate.
Okay.
There's another question, Dr. Lucero. Will teachers be providing online instruction to hybrid students who are not comfortable returning to full in-person?
Yes, you're going to work with your building principals. They must contact your building principal, or whoever they assign that to, and they must have a plan put in place for that student. It can't be that one day you just decide to stay home and the next day you decide to come to school. You have to contact us and let us know that you are not comfortable coming back to school at this time, and the plan will be set for at least for the first week so that we can transition back and forth. So we're not having a lot of people transition back and forth, and then a decision will be made if you will permanently be put into distance teaching and learning academy.
Dr. Lucero, can you talk a little bit about how that expectation will be communicated to parents, I guess, and staff from the district level?
It should be put in the communication from the buildings. There's not another communication that's coming out until Friday from this office. And so I would hate to wait until Friday if families don't already know that they should be contacting you, so that you're not surprised with students who need something different on Monday.
Okay,
so they should be, we'll talk about it this evening on a family chat also, so that they're aware of it.
Okay, maybe the principals, we can get together and get common language, because that would be something that's universal for us.
Yeah, we'll send common language. I'll have the associates do common language for you.
Awesome, thank you, thank you. And we'll reiterate that in our own parent sessions, because we're all planning them this week. Thank you.
Wonderful. And we are letting parents know that as they email this office and as they're calling this office, we are making families aware of that. Okay, if there are no other questions, we're going to sign off at this time. Again, thank you so much for joining us today. Thank you to the building principals who have joined us. We really appreciate it. If you have more questions, please don't hesitate to speak with your building principal. They will get that information up to us if they can't answer the question themselves. So thank you so much. We'll see you soon.